Hi guys, this is Jackie Cooper from JCooperTravels, and today I have a really special guest. Michael's here, and we've met on LinkedIn, and he and I have similar backgrounds and also similar interests. Michael, thank you so much for being here. I'm super excited about your sharing your story, your journey, and what you do with the listeners today. So would you like to give a quick introduction about who you are and your business and all that other good stuff?
Sure. So I'm happy to be here. Thanks for the invitation. My name is Michael Blackman. I'm a physician. I work primarily on medical informatics. I'm an internist by background, so that's general medicine for adults, and so I work helping doctors take advantage of their electronic health records, looking at that data to improve healthcare in general. So how do we use that data to improve the quality of care that's delivered, with a real focus on what's sometimes referred to as population health medicine. Similar to public health, but it's not public health, so I don't want to confuse the two. But it's how do we look at groups of people and decide what we need to do for them and get the things done? Because the fact of the matter is that there's a lot of things we do in medicine that we're sort of reaching at the edges a little bit, and there are a lot of things that we know work. Flu shots, colonoscopies, mammograms are a few examples of those. But yet we don't get them to everybody. So how do we make sure we get them to everybody, understand who to reach out to and how to do that?
Yeah, no, that's a really great overview about what you're doing and some of the areas that I'm going to be asking you questions about. When I mentioned at the start that we have similar interests, it's because when I first started in law, and for those that have been following my podcast, you might know that I'm both a lawyer as well as a special ed teacher. But when I first started in law, my whole area of interest was in patients' rights and was in bioethics and was in how do we support those in the health field, but from the legal side. And it does deal with looking at the science and the information, and then also the distribution of various supports within different communities. So medical informatics, what does that mean? I know that was a term that you shared with me, and I'm wrapping my head around it. So give me in lay language, what does that mean?
It's using data to improve healthcare.
Okay.
So it's taking the data that we have from routine patient encounters and trying to leverage that. How do you put that together, understand what patients need and what one should do?
Okay. And with that, is it the same across the country as to how different hospitals or communities are using the data or have access to the equipment or the tools to actually get the data?
Yeah, so the short answer is it's variable, as I'm sure you don't find surprising. There are multiple systems out there that we have a variety of standards. They don't always work together. As a saying, we have standards. The problem is that we have plenty of them. And standards, frankly, are really important in terms of sharing data, making sure that we can communicate together. Because most people, especially people who have ongoing, medical issues, don't get all of their care from the same place. So the fact of the matter remains, going back to the examples I gave before, if one gets their flu shot, whether you get it at the drugstore, at the supermarket, at your primary care physician or your specialty physician, makes no difference as long as you got the flu shot. So how do we make sure that everyone knows you got that flu shot? And that's where the problem comes together. We think about standards. We have standards in our daily lives all the time. Not to be flippant about it, but when you go to the grocery store and you buy toilet paper, you don't worry if the toilet paper roll is going to fit on the roll holder you have at home. And that's because there's a standard for that.
Yeah. So in the current situation that we're in with COVID, what are your thoughts about the collection of information process now, and how, with your background of medical information systems, how can we maybe use that knowledge to help us, whether it's with this pandemic or something in the future? How can we gain control of how it's spreading, or that is there a way to do that?
Yeah, I mean, that's, part of the reporting. We have mandated reporting for other diseases. COVID certainly would fall in that category. So how do you effectively fully understand the information you have, get it to a centralized location, see that spread? But even as we go forward, the same way we want to track, make people get flu shots. Once a safe vaccine is available, we're going to want to make sure that everybody gets it and gets the appropriate number of doses, whatever that turns out to be. And again, that same kind of tracking will be, is possible here as we take it forward.
So how did you get involved with the electronic health records area? I mean, I know as a lawyer, there's all these different paths that I can do. And I decided early on, I did not feel comfortable in front of a courtroom, but I did feel comfortable working in civil, area and civil rights and things like that. So how did you choose your specialty area?
Well, it's sort of interesting because before I went to medical school, I used to do information systems consulting. And so after going to medical school, I was in full-time primary care practice, really enjoying it. And the health system I was working for was putting in a new electronic health record system. This goes back, dare I say it, almost 20 years. And they were looking for people who were interested in being on the steering committee as to how those systems work, and the governance related. I said, sure, that's up my alley. I'd be happy to help with that. Became more and more interested, became more involved, and got me to where I am today.
So I know you're a physician, but when you go into like the health records area, would someone who is kind of taking a step into that career, would they have to have a special background, or how would they develop that skill set?
Well, if you're talking about it from just strictly health records, there are a lot of people who work on that. I'm not going to suggest I'm an expert in this area. I'm not. But I know there are specific training around, the old version of medical records and tracking them. Because there are a lot of obviously legal requirements that people need to be aware of around how medical records work. But in terms of, there are many, the side I work on, working for a software vendor who make these systems and monitor them and help take them forward. So that's everyone from, we have clinical people working on them, obviously a lot of engineers who work on them, et cetera. So a whole variety of options.
And the reason why I'm asking, for those that might be listening to, I also have another podcast called Cooper Virtual Career Day podcast. And so this interview might also be featured on that podcast as well. So for those that are listening, and you might be in a high school or college, that's something to, from a career perspective, there are a lot of different ways that you can travel in the health area. So something that we talked about is doctors and other clinicians often dislike electronic records. Can you talk to me about why?
Yeah, I think anytime one makes a change, and a change from paper records to electronic records, it's sometimes, I don't like it the way it is, but please don't change it because I'm used to the way it is. I've got it figured out. The other piece, and sometimes, frankly, the workflows don't line up. The records aren't set up appropriately. I mean, even things that in theory are simple, writing a note after seeing a patient. A good note tells a story and lets whoever reads them understand what happened, what the person was thinking, and what they did, and what would be the next steps potentially if someone writes it in that way. Sometimes the notes become checkboxes, and the forms, you sort of lose that communication feel. Additionally, as we've, in the past, decade plus, we've added any number of increased reporting requirements. And those reporting requirements, frankly, wouldn't have been possible without electronic health records. But sometimes the records get blamed for the increased reporting. And there's a tendency to say, well, we're going to capture more data, and therefore the end using clinician, whether that's a physician, a nurse practitioner, or a physician's assistant, even a nurse, captures that information. Well, everybody's already working really hard and really stretched, and adding more requirements sometimes gets blamed on the system. I think it's important to remember as we look at the workflow around these systems is that healthcare is a team sport. No one involved can do this alone. And anytime I'm in a discussion when somebody says, well, we'll just have the physician do that, I must admit the first thing I do is groan, because that's not a good approach. That, in some cases, that might be the right answer, but often it isn't.
Understood. I mean, everyone's time is very valuable, and it's also a question of how do you divide your time. And then, like you and I have talked about, sometimes individuals are already doing this, and it's just a question of changing the method of the collection, because the information is already being collected. So why does having standards in the way health information is recorded matter? I know that from a legal perspective, I can see the reason why, but why don't you share from your perspective?
Yeah, strictly from a clinical perspective, if we want to understand what's going on with a population, as I said before, people often get care in multiple places. We want to be able to share that data across. I mean, healthcare expenses are high. Our annual expenditure on healthcare continues to increase. If we can avoid doing things, and more point, repeating them unnecessarily, that's a benefit. I mean, everything we do carries some risk. I mean, even a blood draw, which has very minimal risk, but it's not zero. You know, you're sticking a needle into somebody's vein, you could get an infection, get a hematoma, also the variety of things that could happen. They happen frequently? Absolutely not. Would I, say to someone, I was worried about that? No. But there is some degree of risk. So the more we can share that information, help people move through the system more efficiently while still maintaining an extremely high level quality of care, the better off we're going to be. And we need those standards to be able to share that information so the same test has the same codes so the computer can understand them from system A, system B, and system C.
So is there an impact of the electronic health records on patients, or, how has it helped, or what's your thoughts on that?
I think it helps patients in the long run. I think sometimes if the workflow isn't set up in the right way in the practice, people find them distracting. All the doctor didn't talk to me. All they did was stare at the computer and type. My experience is the same people who do that are the same people who used to stare at the chart and write. So there's a little bit of that there. But if you set the room up in such a way that the doctor's facing the patient, but the computer's behind the doctor, and the doctor has to turn around, that's a problem. I mean, that's just a workflow problem, and that's a bad setup. So you have to see, as we're doing all of this, all of those things matter. And so, as we look at how, patients can be helped, we can help, identify areas of risk, ensure they get things done. One of the pieces that we've moved to many years, and something I was highly involved with in its early stages, is electronic prescribing, especially of controlled substances. We have a opioid problem in this country, and these problems and we could have a whole separate discussion on why that's the case. But one of the ways that electronic records can help is let the clinicians know what other prescriptions someone may have received. Now, that's not, just because someone has received other opiate prescriptions, that's not a reason in and of itself not to prescribe them. You need to exercise appropriate medical judgment, but it enables the clinician to helps them ask the appropriate questions and therefore drive to the appropriate care. Unfortunately, sometimes it gets seen as, because one of the things that we've been doing lately is most states, I think we're up to all but one, have prescription monitoring programs, especially around, scheduled drugs, opioids, and others. And, one of the things you have to do, and this is true, I have a license in North Carolina. Before I write an opioid, I need to check the prescription monitoring system to see if someone else has gotten one, or if that patient's gotten one from somebody else. It's an important step, and we need to make that easier.
So all great information. Another question popped into my mind. You had mentioned about population health medicine. Can you talk more about that?
Yeah, so as we look at population health, and so we can do that at any level. First question we talk about population health is what's the population? And the population, frankly, can be however one chooses to define it. It could be an individual, all the diabetics in a practice, all the patients with heart failure in a practice. It could be all women in a practice, all patients from a given insurer. So you get the idea. You could take any combination you want and then look at that to say, well, what are the things that we know work? All the prevention stuff, the things that are frankly age and sex-based, colonoscopy, mammogram, flu shots, other vaccines, and things that are disease-based. There are a variety of things, especially for diabetes, which is a major problem in this country. There are interventions that we know work, monitoring that we know works to help control it. How do we ensure that that's done and done consistently? And sort of looking across that population to say, all right, 80% of the patients in your practice are getting the appropriate test. How do we get the appropriate monitoring? How do we get that to 85? How do we get that to 90? In an ideal world, we get it to 100. I think 100, frankly, is a nice goal, but not likely the case. People have choices, they make different decisions. And so a 100 target is probably pushing it a little much, as nice as that would be.
So how can someone like myself, individuals, help improve the healthcare that we receive?
I think one of the biggest things is healthcare should be something that is done with you and not to you. Be a participant, ask questions. And I think as we think about healthcare and the sort of the delivery piece of it, depending on which study you happen to like, only affects about 20 to 30% of one's overall health status and health outcomes. So if that's all you're getting from clinician, what's the rest of it? It's how do you eat, exercise, smoking. So all of those things, so you got to, stay involved, ask questions, and listen. It's not always the same answer for everyone. People make different decisions, and that's fine. But you got to be involved.
Yeah, for sure. So for those that haven't followed the podcast before, or maybe aren't also familiar with YouTube, there's always a block of information above the podcast, above the YouTube, and that's where I'll have information both about JCooperTravels as well as about Michael, so that way if you would like to reach out to him to have him consult with you or ask any questions about the field, you'll have the ability to reach him. As you know, and we've talked about this, True, one of my other passions besides the law and teaching is travel. And so I have been traveling for many years with my daughter, and I ended up becoming a travel consultant. And I actually am able to offer everyone who's listening to the podcast platform and YouTube access to a free wholesale travel booking portal. And the reason why I love the portal is not just because of the discounts up to 35%, but every time that the portal is activated as well as used, we have a foundation that actually makes a donation on your behalf to Modern Relief and Children International. So actually families are fed meals every time that the portal's used. And I think that that is a win-win situation. So even if you're not temporarily, you're not traveling right now, it is, it's a great thing to be able to reach out and help someone else. Where have you, I know we've talked, but where have you traveled? Where's next on your bucket list? I know what's on my bucket list next, but tell me a little bit what's on yours.
Yeah, I frankly have missed traveling in the middle of pandemic. It will come back at some point. It's still going to be a little while, I'm afraid. I like traveling in a way that I get to, understand the community in which I'm traveling in, as opposed to just sort of, a high level view. But in terms of bucket list, one of my bucket list items for a long time has been to go to all 50 states. I am down to one. So New Mexico is high on my bucket list.
Wow.
That's the only one I haven't been to.
That's awesome. That's awesome. I am nowhere even close to that. Because even though I've taken a train with my daughter, the Amtrak across from Washington all the way to California, and I highly recommend, if anyone loves trains, and I love traveling by trains, take the 3-day trip. It was phenomenal. They have a glass view area. You can see how the geography changes from one part of the country to the other. You do have the ability to stop and go on and off. We just went straight through, and it was a great experience, but I don't personally count state, going on a train to different states as actually being in the state.
Yeah, I agree with you. I think either just driving through, or changing planes doesn't count. Over the past several years, had the opportunity with work to work in a number of small rural hospitals all over the country, and that's how I saw a large number of those states.
Yeah, no, that's phenomenal. I think that the road trip is becoming more popular these days. And so, again, it is a great way to see the country and also meet people. So, so for those that are listening, I really appreciate your listening. Please subscribe both to the YouTube as well as to my podcast. It is free. And again, the information on how to gain access to the free wholesale booking platform, as well as other things that I'm sharing, will be on the podcast area, as well as on the YouTube, as well as how you can reach out to Michael. Michael, thank you so much for being here. I really appreciate your sharing your expertise. I know this is an area I knew nothing about. And it's so critically important because of just our healthcare system has gotten a lot more complicated. It's gotten a lot more technical. So records and information and how we share it and how it's collected, it's extremely valuable right now, especially because we can make everything so more efficient. Like you said, if you have certain needs and you move around, then someone can actually support you. Are there any last minute thoughts that you want to share before we sign off?
No, I just hope everyone stays safe through the remainder of the pandemic, and especially get a flu shot this fall. It's going to be very important.
Yep, for sure. That is on my list to do, and I'm going to be making an appointment this week. So thank you for reminding me about that. Have a great day. Thank you so much.
Thank you. It's been my pleasure.